Good morning, everyone. I hope everyone's doing well. My name is Dr. Brittany Davis. Currently a second year resident at Naples Community Hospital in internal medicine residency. Thank you all for having us. This case I would like to briefly introduce by just saying that during the rampage of COVID-19, we all created certain illness scripts that were associated with COVID-19. Most importantly, these illness scripts included severe acute respiratory distress syndromes, fevers, cough, sore throat, dyspnea, myalgia, headaches, and most notably, the diarrhea and olfactory impairment. Just to highlight, ICUs were filled to the brim. We were running out of protective equipment for our healthcare workers. And here we are today to be able to live through it and memorialize those who did not. So today I would like to highlight as we move forward and we learn more about this virus, COVID-19 has had several unusual manifestations over the last year or so. One of the most unusual that I've seen and witnessed during my practice is parotitis. Yes, you heard it right, swelling of the parotid glands. We all know that parotitis, when we think about it, we usually think, oh, buzzword, mumps. With that being said, mumps, secondary to paramyxovirus, is one of the most common leading cause of parotitis, followed by influenza, herpes, Epstein-Barr virus, and sometimes you may even see bacterial infections, which play a large role when someone has a salivary duct stone. One of the things that we want to highlight during this case is the fact that parotitis could be secondary to COVID-19, which is already a rarity, but could further lead to airway compromise, which is also a rarity in the setting of parotitis. So today we present a case of an 84-year-old female with a remote history of a pituitary adenoma, status post-resection 50 years ago, hypothyroidism, as well as adrenal insufficiency. She initially presented to our care with shortness of breath, fevers, and a cough. She was subsequently diagnosed with COVID-19, but at this time she was not started on remdesivir. She was started on Decadron. During her hospitalization, she was stable on the general medicine floor until one day a provider noticed that the patient was more somnolent and unarousable. At this time, she was noted to have a drop in her hemoglobin. Further testing and workup led to the result of her having a gastrointestinal hemorrhage, resulting in shock, requiring an ICU stay, and she was subsequently intubated to protect her airway. During this time, the patient was stabilized, underwent an EGD status post clipping, and was also extubated. During this time, on her road to recovery, she was noted to start to develop some hoarseness and dysphagia. Several speech language pathology evaluations led to her failing her swallow evals. During this time, the patient developed facial and neck swelling that were severe. She was evaluated by providers at the bedside and noted to have increasing oxygen requirements and trouble breathing. At this time, she was emergently intubated in the OR because her intubation was high risk. The patient was started on remdesivir. At this time, continued on antibiotics with mirum and daptomycin, as well as additional IV steroid therapy. For the discussion, we just would like to highlight that just as medical professionals continue to monitor for signs of progressive respiratory failure and identifying patients at high risk of decompensation, they should likewise be aware that parotitis is an emerging COVID-19 complication that can have severe implications if not recognized and addressed promptly, as we have seen in this case. We should also consider that parotitis is an emerging COVID-19 complication that can have severe implications if not recognized and addressed promptly. So we're grateful for our ICU